So traditional knee we have been doing for many years. So how the knee looks like is actually something like this. That's the bigger model, right? So we actually remove the damaged wound surface already, put the metal, plastic metal, and the kneecap itself with the inner surface are damaged. Then we also change the inner surface to the plastic component. So this one already we've been doing conventionally for many years. All right. All right. So then recently we come about the issue or the concept of robotic-assisted surgery. Okay. So robotic-assisted surgery, there are many different systems in the country. And robotic surgery or robotic-assisted surgery is actually meant to be, make sure the surgery is more precise and more accurate. Yeah, look at the implant like it, Richard. You can see the component for the femur and the component for the tibia.
Yes.
So normally you use a normal, usual, conventional jig, saw to cut.
Yeah.
But for robotic-assisted surgery, it's different. Robotic surgery, like the system that we are getting for Beacon, we'll do a CT scan for both lower limb before the surgery as a preparation for them. And the data on the alignment of the joint, the size of the bone will be actually put into the robotic arm.
Wow.
Okay, so the robotic arm has the information of this particular patient. So we do surgery, we open up the knee, and then we again do a lot of mapping on the bone itself, and so that the robotic arm can recognize where is my knee, exactly where the point is.
So the precision is high.
Correct. So then based on the data they have on the CT scan and also the mapping, then it will guide us how much bone to cut. There's a lot of knee deformity, so we have to correct the deformity. So the robotic screen there will tell us, it will tell the surgeon that, okay, this implant should be tilted that way, or tilted this way, or how much bone cut up there, how much bone I cut down there, how I'm going to tilt there, how I rotate the implant. So all these things are set ready during surgery, combined with the data that we have in the CT scan. Then only a surgeon push the robotic arm in and to cut the bone based on the data that the surgeon already set.
Wow, this is very high tech.
So there's no more that kind of big jig here and there to do. And so that cut down a lot of operating time on that aspect. And the jig that we're putting on conventional knee also, sometimes the bone will be osteoporotic. You might actually cause some tilting or cutting error, things like that. So the robotic arm surgery actually allow us to have an idea exactly how much to cut. So once we put the robotic arm in there and we click the button, the saw will cut. And the surgeon cannot force because it's already preset. So that's why if the surgeon is a bit like try to cut more here and there, you have to go back to the data to see whether you are cutting correctly or not. So that's why that's a good thing about robotic assisted surgery.
Wow, it's very high tech. So from conventional knee replacement to robotic surgery assisted knee replacement, you can see it's very different, because conventionally that means you can cut more of your bones. But if let's say we are using robotic ones,
they are
everything
not supposed to be very accurate.
But you at least we map it first using the CT scan, and then the robot does the job. So
the mapping during surgery, so you know exactly how to cut, how much to cut, how to tilt the implant. So that's the beauty about robotic assisted surgery. Precise, accurate, and supposed to be shorter operating time, all right, particularly for those that have experience, and also the less blood loss and shorter hospital stay. They walk almost immediately. For the day 1 or day 2 itself, they walk. And so that's a good thing about robotic assisted surgery.
Wow. Dato, I just have one question. I believe that our audience now, we are so mesmerized by this robotic assisted surgery. One question in my heart, is it expensive? Is it more expensive than conventional knee replacement surgery?
Theoretically, yes. Okay, because you have no more gadget to play, you have to do a scan, things like that and so on. But I think that in terms of cost and charges, different hospitals have different way. And definitely the hospital side will actually adjust such a way that it's not too far from the conventional knee replacement. And in fact, to make it more affordable, because hospital always believe that patient's safety, patient's what do you call that, the financial status and so on. We have to respect that as well, so that we do not want to burden the patient and the family because we introduce robotic surgery.
All right.
All right, so I think patient's side is always the first priority.
Okay.
Not only the safety alone, and we have to make the robotic surgery available, accessible, and affordable.
Okay.
So these three A, I think that's most of the hospital will do, and definitely Beacon will be actually considering heavily on these three: available and the accessible and affordable for all our patients.
Oh, that's glad to hear.
Yeah.
Comparing conventional knee replacement and also robotic-assisted knee replacement, are there any differences in the pre-surgery preparation and also post-surgery recovery?
Yeah. And as I mentioned earlier, the system we're going to get is actually, we need to do a CT scan for the lower limb and with minimal cost. And that is important to actually feed the data of the robotic arm. Different systems using different sort of way. So some systems, they do not need the CT scan, but we actually chose the system that we use here because, and that's something that most reliable and one of the best in terms of the success rate and the way the technology worldwide. Okay, so that's why we chose to have that system that we have now. So definitely preparation wise, besides the pre-surgery physician consultation and the blood test and so on, extra is a CT scan. After surgery, we try to walk them, stand them as soon as possible. Because by right, the pain should be less because less soft tissue cutting, blood loss will be less, and the hospitalization should be also shorter, so they can walk faster.
Wow, that's really good considering that the price is not that. The price difference is not that high, and the downtime is less. I think robotic-assisted surgery is something that we can consider.
Yeah.
Yes.
And the system we're getting is not only for allow us to do a total knee replacement, also allows a unique compartment knee replacement. We have some younger patients, they are not having the damage, all the three components. In the knee joint, we have three compartments there, see? Inner, outer, and the kneecap compartment. So most of the older patients have three compartments involved. So you do a total knee replacement. But some younger ones, they have one inner compartment involved. The other compartments still look good. So that's why surgeon will choose to change the one compartment.
So more partial.
So you partial, or we call unique compartment knee replacement. And the system that you're getting also allows us to do a total hip. So one system allows us to do all three. Means that total hip replacement surgery can also be done and commonly being done now with robotic-assisted surgery as well.
Okay.
Yeah.
I'm very excited to hear that in Beacon Hospital we are getting this robotic-assisted surgery. And when can we book the appointment if let's say we want to do this?
In fact, patients have been seeing me the last 1 to 2 months. We've been offering them the option. All right, and as I say, we also respect patient family decision. So we tell them that we actually have two systems, that you can do a conventional, you can do a robotic-assisted surgery. So some patients that prefer to use a robotic surgery, a robotic-assisted surgery. Then we will choose that for that patient, and we do the preparation accordingly.
All right. So post-surgery, after the knee replacement, what do the patient need to come back again for follow-ups, or what are the things that that patient need to take care of, or anything?
Yes, that's a very common question.
Yes.
I'm glad Richard mentioned it. And after surgery, when they are actually in the ward, they really know what to do. They really stand and walk. They know how to walk to the toilet. They know how to walk back to the bed, and they know how to walk the corridor with a frame or with a stick. They learn it from the physiotherapist. So by the time they go home, there are 4 options. One, they do not need any physio. They say, "Doc, I don't really know exactly what to do. All right, I do not need any physio. I do it myself at home." Second option is they come to the hospital regularly, maybe alternate day for the next maybe 10 sessions to learn from a physio how to stand, how to walk. The third option is actually they can arrange a physio to go to their house to do for them. And the fourth one is actually those who stay in the hospital, or they might have another private hospital somewhere or private physio, they can actually do a physio there. So there are 4 choices for them. So you can actually discuss with the patient, the family, which is most convenient for them, because some of them they stay far away, they don't want to come back to Beacon Hospital for physio. So respect them, arrange for them. And some even family that nobody take care of the parents, they actually arrange to go to another rehab hospital, all right, to do the physio, to stay in as inpatient physio. So all these things can be arranged. That's not an issue actually.
Okay, all right. Okay, so I believe that our audience here, everyone now will understand more about the difference between conventional knee replacement and also robotic-assisted knee replacement. And I believe that Dato today have shared with us a lot, very comprehensively about the difference between the two. And Dato, for the last message, if there's a one take-home message that you want the audience to know, what is that message?
Okay, you have knee arthritis in an older patient, a senior citizen, and do not delay, and you need to see a doctor as soon as possible. If surgery required, the doctor will tell you, the surgeon will tell you. When the surgeon do a surgery, there must be a reason why the surgeon asks you to go to surgery. And you think of surgery, you have to convince yourself that you did surgery. You have to understand the whole process. And then you can have option. You want to go for conventional knee replacement, or you want to go for robotic-assisted surgery. So that's something that you have to discuss with the surgeon. And then the surgeon will always, as I say it again, respect the patient decision, the family decision. And then your surgeon should be familiar and also skillful enough to do both surgery, whichever the patient prefer to have.
Okay, thank you very much, Dato, for your time today, and we are very privileged to have you today to share with us some of the knowledge of this bone and joint, especially on knee replacement. Thank you so much, Dato.
My honor.
Thank you so much.
Thanks.